Good afternoon, I'm Velshi. President Trump is about to hold a news conference in the White House Rose Garden in which he is expected to declare coronavirus to be a national emergency. The move is important. It would allow FEMA to provide disaster relief funding to state and local governments, as well as federal assistance to support the coronavirus response. It would also allow the agency to circumvent legal barriers to get aid distributed more quickly. A short time ago, House Speaker Nancy Pelosi announced that the House will be voting on a coronavirus bill this afternoon. Pelosi says the bill provides for free coronavirus testing for anyone who wants it. It also provides 2 weeks of paid sick and family leave and strengthens unemployment insurance for people who lose their jobs. Pelosi says the bill is designed to protect families.
Our bill takes aggressive action to strengthen food security initiatives, including student meals, as well as SNAP, seniors' meals, and food banks. As we develop our next steps, we will continue to listen to and benefit from the expertise of scientists, healthcare professionals, public health officials, and community leaders so that we can craft the most effective evidence-based response.
Now, these announcements come as Wall Street hopes to end a terrible week on a positive note. Check that out. The Dow's up 4% right now, about 849 points. I always tell you that I've seen all this over my time as a reporter. I've never seen a day like yesterday where it was off 10% on the Dow. But right now, we've got major markets all on the upside. The Dow, the S&P 500, and the NASDAQ. None of this is going to make up for the terrible few weeks we've had on the Dow. But it is interesting to see that you can actually see green arrows from time to time. A few hours from now, the United States implements a travel ban for people who have been in certain European countries for 14 days prior to their scheduled arrival in the United States. It does not apply to U.S. citizens and legal permanent residents or their family members, and it does not affect trade. The nation's top infectious disease expert says this could actually make a big difference.
Today, the new China is Europe, because Europe now is the major element, the major geographic component that is now seeding other countries throughout the world. And that's the reason why we made the very difficult but appropriate decision to have a travel ban on the European countries. So we are definitely ahead of the curve on that.
All right, all of this comes as more steps are being taken to try to contain or stop the virus from spreading. Louisiana says it's moving its primary from April 4th to June 20th. More states and cities announcing school closures, more museums, theme parks, other tourist venues are closing, more sports events are being postponed. But there is good news for some affected businesses. The food delivery company Grubhub says it's going to temporarily stop collecting commissions from restaurants that use its service. Now, while we wait for the president, let's take a look at what's happening on Wall Street. David Gura joins us now from the floor of the New York Stock Exchange. David, what's the sentiment down there? Because the last couple of weeks, particularly on a Friday afternoon, we have seen, I don't want to call it desperation, but we've seen a real energy behind selling stocks.
Yeah, nice to see the monochrome change down here. There's been a lot of red here for the course of the week. As I've been here, we're seeing green today, as you mentioned, not quite at session highs. When the market opened this morning, we saw the market try to recoup some of those losses yesterday, as you said, down 10% on the day yesterday, the worst day since 1987 for the Dow, the largest point loss in the Dow's history. I've been sort of watching what's been happening between the Treasury Secretary, Stephen Mnuchin, and Nancy Pelosi up on Capitol Hill. I'm having a heck of a time here following Drew Hamill, who's Nancy Pelosi's deputy chief of staff, who is chronicling on his Twitter feed all of the phone conversations that those two leaders are having. I think we're up to 9 phone calls today between the two of them trying to hammer this out, the last one of which happened after Nancy Pelosi gave that statement to the press at about 2 o'clock Eastern time. He, the Treasury Secretary, came out of the gate this morning, did an interview with CNBC, and talked his book pretty well. Talked about what the White House hopes to do, talked about shoring up liquidity, yes, in the markets, but also keeping an eye on industries that have been suffering here as well. As you know, Ali, airlines have been hard hit as a result of what we've seen here over these last few days. Those stocks were down 40% yesterday. Cruise stocks down 75% yesterday. So that guarantee coming from the Treasury Secretary that the administration is going to do something, that cheered investors. All the while, you're waiting to hear what the president has to say. As you know so well, in this administration, it's often the president who sweeps in at the last minute and makes a change or corrects something. We saw him doing that to himself last night after that statement that he delivered in the Oval Office. Everyone here, all investors waiting to hear what the president says, as you said, in just a couple moments' time. Ali?
And David, interesting point. There are definitely some companies that will suffer long-term effects as a result of coronavirus. I can imagine that cruise lines are going to have a tough time to recover. But an airline being off 40%, defies a little bit of logic.
It does, and we're going to have this conversation now, I think, about sort of what industries are systemically important industries as the Treasury Secretary starts to talk about these things in that light. As you say, you know, airlines are suffering. We've seen cancellations. We've seen the nervousness that they have, the anxiety that they have, as we all do, about the growth of this virus, about this public health crisis. But I think that there is an awareness now among investors that we are on the cusp of a downturn, if not a recession. I was looking at notes this morning. More market economists talking about the prospect for recession happening sooner here. There is a sense that this is unprecedented. The economy is not doing well, and all that we're describing, the closures on Broadway, the sports closures, all of that is going to lead to a downturn in this economy, the size of which we have yet to fully reckon with, Ali.
All right, David, thank you for being there. David Gura for us at the New York Stock Exchange. The president's announcement comes hours before it gets tougher for some foreign nationals to come to the United States. Starting at midnight, any foreign national who has visited one of 26 identified European countries will be banned from entering the United States. NBC's Keir Simmons is at London's Heathrow Airport, which is the busiest airport in Europe, and there has been a rush for people who were initially, Keir, confused about what this thing is, because when the president announced it, he said everybody, so lots of Americans sort of looked for tickets to get back, and still some confusion about what's supposed to happen. How's it playing out at Heathrow?
Yeah, that's right. And just to segue from your earlier conversation there, Ali, this will interest you, this figure. This time last year, in the month of March last year, almost 900,000 Europeans traveled to North America, all of them going inevitably to spend money. None of those people will be traveling from midnight to night. Economic implications. Before you even start to talk about the hit on the psychology of Americans who are here in Europe trying to enjoy a dream vacation, and it's now turned into a nightmare for many, because many have told people, including me, about phone calls in the night from relatives telling them that the president has made this announcement, they need to get out. Many of them acted very quickly. One couple I spoke to from California packed their bags, flew from Portugal to here in London. Now they're holed up in a hotel here in London, on hold with their airline, trying to early up their flight back to the United States. They plan to fly out tomorrow, but it is very confusing for people. Just to be clear, as you say, Americans are, of course, not banned from flying home from here in Europe after this deadline tonight. But one of the things people have been saying to me is, well, how do we know the rules aren't going to change again? For all human beings, when there is instability and concern like this, we all just want to get home, don't we? And I think that's what a lot of Americans are doing, trying to do right now, trying to get seats on these planes out of airports like this.
Keir, thank you, my friend. Keir Simmons for us at London's Heathrow Airport. Well before the World Health Organization declared the coronavirus to be a pandemic earlier this week, a little-known unit within the American intelligence community already knew the virus would reach pandemic proportions. It's called the National Center for Medical Intelligence. You probably never heard about this, the NCMI. It's the intelligence community's eyes and ears when it comes to global disease outbreak. NBC News intelligence and national security correspondent Ken Delanian has been taking a closer look at this unit, and he joins us now from Washington. Ken, what did you learn about this?
Well, these officials would not speak to us or grant us a tour of this facility up at Fort Detrick, Ali, but current and former officials told me that the National Center for Medical Intelligence is the IC's eyes and ears in a global pandemic like this, and they have access to information that the World Health Organization and the Centers for Disease Control do not have, and that includes communications intercepts conducted by the National Security Agency, human source reporting gathered by the CIA, satellite imagery. So they see things at times earlier than the CDC and the WHO. And in this case, we are told that China was not telling the truth in the initial stages about the extent of this outbreak, and they were able to report that to Trump administration leaders. Now, what's an interesting question that I don't know the answer to, Ali, is what other warnings did they give? Were they presented to President Trump? Did he act on them? That's a question that we're going to continue to ask.
Do you know if this organization is playing a role in developing the response? If they've known about it for so long, are they instrumental in determining what happens next?
their role is more of an information gathering role, Ali, and they're continuing to analyze, the intercepts, the source reporting, the satellite imagery, and they have some of the world's greatest experts in pandemics. So they're doing classified intelligence analysis that goes along with the Anthony Fauci's of the world, and that's being presented up the chain to the White House.
Ken, thanks for your reporting on this. Ken Delanian. What are the workers on the front lines of coronavirus pandemic seeing? Joining me now, Dr. Natalie Azar. She's an NBC News medical contributor. Natalie, so much information is coming out here, and really it's one of those things that coronavirus manifests like other things. And this is a problem because there are lots of health issues like that we don't realize that it's something more serious because it felt like something else in the beginning.
Yes. Oh, that's your question.
Yeah, so what are we learning about how to deal with this?
So, we are starting to study now case series, and that's fantastic because we're trying to get, or we are getting, just a really interesting clinical picture of how patients go through the phases of exposure, initial symptoms, and how they end up, getting really sick.
Yep.
And what we're finding out is that initially the virus is in the upper respiratory system, in the nasal tract and in the throat. And in folks who get in trouble, it starts to travel down through the airways and into the lungs, where they then develop pneumonia.
What does it feel like? How would you be fooled into thinking something else?
And we're doing this a lot to try to say, how do you tell the difference between, at this point now, allergies, cold, flu, and COVID? And I would say one of the biggest differences is that when people have some stuffiness, a little bit of a dry throat, the percentage of patients with COVID who had that was in the minority.
Got it.
The most common early symptoms were a dry cough, fatigue, malaise, the achiness that we usually associate with flu, right? But the difference is that it's a little bit more indolent, meaning that it's a few days of that, and then on average, people started to develop shortness of breath around day 5, and in those folks who got really sick, it was after that. Now that's in contrast to flu. If anyone's ever had the flu, you kind of know you go to work one day, the next day you get
like a truck hit you.
Hit like a truck, exactly. And so we aren't seeing that kind of clinical picture emerge. Now again, these aren't absolutes, but a few pearls that I think are really important, because as a practitioner, I have to say, what's my clinical suspicion? Is it mild, moderate, or more, to actually, deploy the protocol to get someone tested?
So the clinical suspicion is interesting because that leads to screening, which isn't necessarily testing, but there's a sense that if everybody is in touch with what they should be feeling and they have a way to be in touch with a clinician, we can screen rather than just test.
And the problem is that, there's definitely an algorithm. I mean, there used to be a really tight one. You must have traveled to China or known someone who did, and then you must have tested negative for everything else, but you're in the hospital. Now, I mean, we know now that people, number one, can have no symptoms, or number two, have mild symptoms. So ideally, we would be able to run the test the same time you would run a flu test on someone. If they were that sick or having those symptoms, we should be able to run those COVID tests, because not because it's going to change the management per se, right? There's no, unless you're super sick, you're not going to be treated with an antiviral. You're going to be told to go home, isolate, rest, take fever reducers.
Which, by the way, happens with the flu in a lot of cases. In fact, I would argue most people I know who say they've had the flu, and I believe them given their symptoms, I have.
They stayed home.
I didn't go to a doctor to determine that.
And one point that we're really trying to reinforce, if we haven't said it enough times, is to not just show up, at an urgent care doctor's office or an ER with fever and cough, because you will be masked and isolated. If you're having mild symptoms, you reach out to your doc with a phone call, with a virtual urgent care. My hospital and many hospitals are really augmenting that telemedicine now for exactly that purpose, to screen people remotely. But certainly, if you have, here are my 4, trouble breathing, chest pain, intractable vomiting or diarrhea, or high fever, you can make a call, but you're going to get medical attention right away. We don't want those folks staying home and
so to some degree, we are asking people to get a little more sophisticated about their own, not just don't feel good or I feel a little tired. We're asking non-professionals to have to diagnose themselves a little bit.
Well, but as I've said, I think I said it on the Today Show yesterday, every doctor and every healthcare worker, nurse and PA and NP, my goodness, we're all anticipating. My entire inbox is filled with, this is what's going on, what should I do? I mean, we're here to answer those questions. We may not know all the right answers, but at least we're there to try to give you the best guidance.
Natalie, thank you. As always, you are spending a lot of time explaining this over and over again, but we appreciate it. We need it. Natalie Azar, NBC News medical contributor. House Democrats and the Trump administration are said to be close to agreeing on a stimulus package aimed at easing the economic damage caused by the coronavirus. One thing Democrats are pushing for is paid sick leave for all workers who are affected by the pandemic. What a great excuse to take a closer look at this remarkably important issue. According to the Bureau of Labor Statistics, nearly 3/4 of all private sector workers have the ability to earn paid sick leave. But that means more than 30 million American workers cannot take paid sick days. 93% of the highest wage workers get paid sick leave, while only 30% of the lowest paid workers do. And when you break it down by job status, 83% of all full-time workers get paid sick leave, compared with just 43% of part-time workers. Now, the chances of getting sick leave may also depend on your profession. Most workers in the information, financial activities, education, and health services sector receive paid sick leave, while workers in construction, leisure, and hospitality, resorts, hotels, food service workers are less likely to get it. The reason Democrats are pushing for paid sick leave is because there is no federal law guaranteeing paid time off if you get sick. 12 states and 12 states and Washington, D.C. have passed laws that require most businesses to offer paid sick leave, and a number of cities, including New York City, Dallas, San Antonio, and Austin, Texas, have passed ordinances requiring it. However, the National Council of State Legislatures says a number of states, particularly in the South and the Midwest, have laws that prevent cities or counties from enacting paid sick leave laws. That means while some office workers may be able to work from home or self-quarantine right now, many low-wage workers who can't afford to lose a day's pay have to show up to work as usual, even if they're not feeling well. Which is a problem for them, might be a problem for the people they work with, too. Joining me now to talk about what should be done to help these workers is Michael Strain, Director of Economic Policy Studies at the American Enterprise Institute. He's the author of a new book, The American Dream is Not Dead, but Populism Could Kill It. Michael, let's talk about this. We are not amongst the most advanced countries when it comes to paid sick leave and child care. A couple of issues that don't seem to be the most worker-friendly policies. But this is where it comes home to roost, right? There are people who can't afford to miss time off of work. They won't take time off of work. Generally speaking, that's harmful for the individual worker. But in the case of a pandemic, it's actually harmful to everybody else.
Yeah, Ali, that's right. And I would oppose a law that required all employers, to offer paid sick leave to their workers. I think that there are trade-offs associated with that I wouldn't make. I think it would make it harder for low-income women of childbearing age to get jobs. And I think we have to think about how to balance those trade-offs. Where I come down is let's not have that requirement placed on businesses. But now really isn't the time, I think, to be trying to set up an entire new paid leave program. You're absolutely right that we don't want workers who are sick, particularly low-wage, hourly workers who won't get paid if they don't show up to work, to go to work feeling sick because they don't have the ability to stay home and still get paid. Congress should just cut all those workers a check. Rather than trying to set up a whole new paid leave system, just mail checks to low-income households in states with severe outbreaks. That would serve the purpose that a paid leave program is designed to serve, but it would be a lot easier to do, and it would be a lot more efficient, and you could get it off the ground tomorrow.
So here's the thing. Yesterday, when the Fed announced it was injecting money to the tune of about $1.5 trillion into the system, I tweeted that out, and I got probably 20,000 interactions to that tweet, almost all of which were negative, to say, wait a second, there was $1.5 trillion somewhere that somebody could just inject in the financial system that saved the market for about 20 minutes or so. This idea of cutting checks, there are a lot of Americans who say, let's do it. Cut me a check. By the way, while you're at it, can you cut me a check for my college debt? And can you cut me a check for my health insurance? Because everybody keeps on saying, how do you pay for stuff like that? Tell me why some systems work better for cutting a check and some systems work better for redoing the entire system.
The reason in this case is the urgency. Right now, we have an urgent need to act in the state of Washington, for example. We may have an urgent need to act in New York. And trying to figure out a temporary policy that requires employers to give their employees paid sick time that would be effective enough in delivering that income support to those workers seems to me to be pretty challenging. We should be looking for the simplest things we could do that will effectively address the problem. And I think the simplest thing we can do to address the problem in states experiencing severe outbreaks is to send money to low-income households that need it. That way, if they're sick, that finances their time away from work. They don't feel like they have to go to work. You solve an economic problem. You also solve a public health problem. It accomplishes what the paid leave program that the Democrats are talking about wants to accomplish, but it does so in a much simpler and more straightforward way.
Wouldn't it be better, though? I mean, would you agree that it would be better if people who were sick didn't have to go to work over the long term? I understand that there's an emergency need, and I agree with you that sending people checks right now is actually going to be simpler than trying to implement policy that we don't have bipartisan agreement on. But why don't we fix this? Other modern countries do.
So outside of the context of this emergency, it goes back to the trade-offs that I mentioned earlier. You know, if you are a worker with relatively fewer skills, with relatively less education, you're a female and you're in your childbearing years, my concern is that employers, if they're required to give you paid time off, will be less likely to hire you.
But that's the same argument about a minimum wage, right? I think we can agree we need a higher minimum wage than $7.25, but that's the argument, that some people won't hire you at $15 an hour when they would have at $8 an hour. But we sort of...
That's right.
Don't we agree that that's fair?
And so you have... Well, I mean, I think it is the same argument, and so you have to figure out what's the most effective thing that we can do in this situation. And I think that there are things we could do to help low-income women if they get pregnant, to help low-income hourly wage workers, regardless of their gender, if they get sick, to finance time away from work, other than imposing that mandate on workers. We could increase earnings subsidies, for example. We could increase incentives to save in the event that you get sick. There are things we can do to help hourly wage workers who get sick and to help women who get pregnant to finance time away from work that wouldn't have the effect of making it less likely for businesses to hire them, or at least wouldn't have an effect as strongly as a federal mandatory paid leave policy.
Well, so that you and I don't get into trouble, I'm not going to have too much more of a discussion between two guys about what's best for working women in America, but we'll continue this discussion afterwards. Michael, thanks very much. Michael Strain is the Director of Economic Policy at the American Enterprise Institute. Donald Trump addressing the coronavirus from the Rose Garden. Let's listen.
Made tremendous progress. When you compare what we've done to other areas of the world, it's pretty incredible. A lot of that had to do with the early designation and the closing of the borders. And as you know, Europe was just designated as the hot spot right now, and we closed that border a while ago. So that was lucky, or through talent, or through luck, call it whatever you want. But through a very collective action and shared sacrifice, national determination, we will overcome the threat of the virus. I also announced Wednesday night, following the advice of our medical professionals, who are doing a tremendous job, and we appreciate it very much, that we're suspending the entry of foreign nationals who have been to Europe in the last 14 days from entering the United States. Citizens, permanent residents, and our families, any of the families returning from Europe, will be subject to extra screening as well as self-isolation for a period of 14 days. As the World Health Organization confirmed today, many of the things that what we said were 100% correct, including our designation before them of Europe. Like our earlier very aggressive actions with China, this measure will save countless lives. I appreciate a number of the folks behind me, number of the people behind me said that that saved a lot of lives, that early designation. But it is only the beginning of what we're really doing, and now we're in a different phase. We had some very old and obsolete rules that we had to live with. It worked under certain circumstances, but not under mass circumstances. They were there for a long time. They were in place for a long time, and we're breaking them down now. And they're very usable for certain instances, but not for this. To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. Two very big words. The action I am taking will open up access to up to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order, I'm urging every state to set up emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right behind me and aside of me. I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged. New York and various other places are also very engaged. I just spoke with Governor Cuomo. We had a very good conversation, and we're working very strongly with many states, including New York. The emergency orders I'm issuing today will also confer broad new authority to the Secretary of Health and Human Services. The Secretary of HHS will be able to immediately waive provisions of applicable laws and regulations to give doctors, all hospitals, and healthcare providers maximum flexibility to respond to the virus and care for patients. This includes the following critical authorities: the ability to waive laws to enable telehealth, a fairly new and incredible thing that's happened in the not so distant past. I tell you, what they've done with telehealth is incredible. It gives remote doctors visits and hospital check-ins, the power to waive certain federal license requirements so that doctors from other states can provide services in states with the greatest need. Number two, the ability to waive requirements that critical access hospitals limit the number of beds to 25 and the length of stay to 96 hours. The ability to waive the requirements of a 3-day hospital stay prior to admission to a nursing home, big thing. The authority to waive the rules to hinder hospitals' ability to bring additional physicians on board or obtain needed office space. They can do as they want. They can do what they have to do. They know what they have to do. Now they don't have any problem getting it done. The authority to waive rules that severely restrict where hospitals can care for patients within the hospital itself, ensuring that the emergency capacity can be quickly established. We'll remove or eliminate every obstacle necessary to deliver our people the care that they need and that they're entitled to. No resource will be spared, nothing whatsoever. 10 days ago, I brought together the CEOs of commercial labs at the White House and directed them to immediately begin working on a solution to dramatically increase the availability of tests. Other countries have called us and worked with us, and they're doing similar things or will be doing similar things. As a result of that action, today we're announcing a new partnership with private sector to vastly increase and accelerate our capacity to test for the coronavirus. We want to make sure that those who need a test can get a test very safely, quickly, and conveniently. But we don't want people to take a test if we feel that they shouldn't be doing it. And we don't want everyone running out and taking, only if you have certain symptoms. Using federal emergency authorities, the FDA approved a new test for the virus. We did this within hours after receiving the application from Roche, a process that would normally take weeks. We therefore expect up to 500,000 additional tests will be available early next week. We'll be announcing locations probably on Sunday night. I want to thank Roche, great company, for their incredible work. I'd also like to thank Thermo Fisher. The FDA's goal is to hopefully authorize the application within 24 hours. It'll go very quickly. It's going very quickly, which will bring additionally 1.4 million tests on board next week and 5 million within a month. I doubt we'll need anywhere near that. At the same time, we've been in discussions with pharmacies and retailers to make drive-through tests available in the critical locations identified by public health professionals. The goal is for individuals to be able to drive up and be swabbed without having to leave your car. I want to thank Google. Google is helping to develop a website. It's going to be very quickly done, unlike websites of the past, to determine whether a test is warranted and to facilitate testing at a nearby convenient location. We have many, many locations behind us, by the way. We cover this country and large parts of the world, by the way. We're not going to be talking about the world right now, but we cover very, very strongly our country. Stores in virtually every location. Google has 1,700 engineers working on this right now. They've made tremendous progress. Our overriding goal is to stop the spread of the virus and to help all Americans who have been impacted by this. Again, we don't want everybody taking this test. It's totally unnecessary. And this will pass. This will pass through, and we're going to be even stronger for it. We've learned a lot. Tremendous amount has been learned. I want to thank Deborah Birx, and I want to ask her maybe to come up and say a few words as to what's happening. Dr. Birx is a highly respected person I've gotten to know very well over the last 6 days. And what we've done is rebuilt something that was very old-fashioned, somewhat obsolete, certainly obsolete when it comes to the kind of numbers that we're talking about. Dr. Birx, please. Thank you, Deborah.
Thank you, Mr. President. It's a pleasure to be here with all of you. I think you know at the beginning of this epidemic, HHS through CDC proactively developed an assay built on the existing flu surveillance system. That surveillance system was then converted to diagnostic system. But last Tuesday, seeing the spread of the virus around the globe, the President realized that our current approach to testing was inadequate to meet the needs of the American public. He asked for an entire overhaul of the testing approach. He immediately called the private sector laboratories to the White House, as noted, and charged them with developing a high-throughput quality platform that can meet the needs of the American public. We are grateful to LabCorp and Quest for taking up the charge immediately after the meeting, and within 72 hours, bringing additional testing access, particularly to the outbreak areas of Washington State and California, and now across the country. We are also very grateful to the universities and large hospital systems that took up the charge to develop their own quality tests, made available by new FDA guidance. This has resulted in expanded testing across New York, California, Washington, Colorado, and you see sometimes those drive-through options that have been made available through these high-throughput options. Following the meeting last week, major commercial laboratory equipment and diagnostic companies took immediate action to adopt and develop new testing systems. Last night, the initial company, Roche, received FDA approval, moving from request to development to approval in record time. This innovative approach centered fully on unleashing the power of the private sector, focusing on providing convenient testing to hundreds of thousands of Americans within short turnaround times. In less than 2 weeks together, we have developed a solution that we believe will meet the future testing needs of Americans. I understand how difficult this has been. I was part of the HIV/AIDS response in the 80s. We knew from first finding cases in 1981, it took us to almost 1985 to have a test. It took us another 11 years to have effective therapy. It is because of the lessons learned from that we were able to mobilize and bring those individuals that were key to the HIV response to this response. I understand that a lot of this behind-the-scenes action over the last couple of weeks was invisible to the press and the American people. But this intense effort has not only resulted in innovative solutions, but an automated high-throughput system bringing the availability of these quality coronavirus testing to the American people at unprecedented speed. Finally, I want you to know in South Korea, they did have a large number of tests available over the last several weeks. Their positivity rate is between 3 and 4%. With LabCorp and Quest expanded testing, their positivity rate is between 1 and 2%. So we want to also announce this new approach to testing, which will start in the screening website up here, facilitated by Google, where clients and patients and people of interest can go, fill out a screening questionnaire, move down for symptoms or risk factors, yes. They would move down this and be told where the drive-through options would be for them to receive this test. The labs will then move to the high-throughput automated machines to be able to provide results in 24 to 36 hours. That is the intent of this approach. We have seen it work just in our own United States, and we want to bring this across the continent. Thank you very much.
Thank you very much, Brett. I'd like to maybe have Tony, do you want to come up? You've become I think everybody out here knows you pretty well, but Tony's been doing a tremendous job working long hours, and you've seen a lot happen, but this has been, it's been a great experience, and working with you has been terrific. Tony, please.
Thank you very much, Mr. President. This is an example of, another example of what I've been referring to in my discussions with many of you in the audience as a proactive, leaning forward, aggressive, trying to stay ahead of the curve. And what you've seen now with this order is that we're going to be able to remove the constraints so that people at the state, the local level, the individual physician, all the way up through the federal government will have as many constraints as possible removed for them to do everything they possibly can so that we can implement the things that we've been talking about. The containment, the mitigation, so that, as I've said many times, that curve that I refer to that goes up, we don't want to have that curve. We want to suppress it down to that small mound. And I think what we've done today is something that is going to be a very important element in having us be successful in doing that. We still have a long way to go. There will be many more cases, but we'll take care of that. And ultimately, as the president said, this will end. But what's going on here today is going to help it to end sooner than it would have. Thank you.
Thank you very much, Tony. If I could, some of these folks who we know, they're celebrities in their own right. They're the biggest business people, the greatest retailers anywhere in the world. And one of them is Doug McMillon from Walmart. And I'd like to have Doug, if you would, say a few words, wherever you may be. Good, Doug, please.
When we got the call yesterday from the White House, we were eager to do our part to help serve the country. And given what we're facing, that's certainly important to do. We should all be doing that. So we've been asked to make portions of our parking lot available in select locations in the beginning and scaling over time as supply increases so that people can experience the drive-through experience that the president described. We'll stay involved and do everything we can from a supply chain point of view to be of assistance. Thank you, sir.
Thank you very much. Appreciate it very much. I'll just stay right over here. And Richard, if you could come up, please. Richard, please. Walgreens, thank you.
Yep. Thank you, Mr. President. And similar to Doug and Walmart, we're happy to stand in here and help in communities all across America, because a lot of times when we have natural disasters, our stores are a beacon in the community, and this situation is no different. So we look forward to partnering with the CDC, the administration, HHS, and the task force, and specifically to the Vice President's doing such a fantastic job. We're ready to engage and help. Thank you.
Thank you very much. Great job. Thank you very much. Brian Cornell, Target. Thank you, Brian. Thank you, please.
Well, Mr. President, thank you for inviting us here today, along with our colleagues from Walmart and Walgreens and our partners at CVS. Normally, you'd view us as competitors, but today we're focused on a common competitor, and that's defeating the spread of the coronavirus. And we look forward to working with the administration to do our fair share to alleviate this growing threat. So thank you for including us today. In the near term, we're all committed to making sure we're keeping our stores open to serve the American consumer who's rapidly stocking up on household essentials, key food and beverage items that they need during this time, making sure we run safe stores and create an environment that's safe for our team members making sure that they feel supported during this very critical time. So thank you for including us.
Thank you very much. Great job. Is Tom here? Tom Poland? Tom Poland, please.
Thank you, Mr. President. As CEO of Becton Dickinson, we're one of the leading providers of medical devices as well as collection products for testing of coronavirus. We're ramping up our manufacturing capacity to ensure that the right collection devices and testing equipment are ready to address this issue. Thank you, Mr. President.
Thank you very much, Tom. Great job you've done. Stephen Rakowski, Quest Diagnostics, please. Great job. Thank you very much.
Thank you very much. Thank you, Mr. President. So as mentioned, we were called with the leadership of the Vice President last week to come together as an industry. And we took advantage of that opportunity to work with the FDA, to work with the Center for Disease Control. And we are up and running with tests in a number of our facilities. As the President mentioned, we now have capabilities from Roche Diagnostics that we will bring into our facilities this weekend. And I know myself and my colleague at LabCorp will be doing the same. So the capacity available to the American public to support this action with consumers will be considerably increased in the next few weeks. Thank you, Mr. President.
Thank you very much. I appreciate it. Thanks. And Matt Sauce, please, of Roche. Matt, thank you, Matt.
Thank you, Mr. President. So from Roche, we want to thank the FDA for their rapid approval of our coronavirus test. We really appreciate the partnership with the CDC and the FDA to get that to market as fast as possible, because it's critical for us to make that available to help patients in need, and working with laboratories to get it up and going in the near future, which will bring hundreds of thousands of tests available to patients in need in the United States. So thank you.
And you can do it. You can do it. Great company. David Pierre of Signify Health, please. Thanks, David.
Thank you, Mr. President. We are the largest house call provider in the U.S., and we go to the homes of the most vulnerable elderly. And through our network and our logistics engine, we stand ready to help and provide our clinicians to be where they're needed, whether they're in retail clinics or in the home. And we're here to assist. Thank you very much.
Thank you very much. And we'll be changing a lot of the rules, regulations for future, should this happen in the future, which we hope it never does, but it will, I guess, somewhere out there. And some bad ones over the years, and I guess that'll continue to an extent, but we hope it never happens. But we're going to be changing a lot of the old rules and specifications and regulations. Adam Schechter, who's really been of tremendous help, LabCorp, please. Adam.
Thank you, Mr. President. At LabCorp, we're working every second of every day to increase the number of tests that we can run. We're working with academic medical centers, with our colleagues at Quest, with other hospital and other laboratories to ensure that we do everything we can to increase the testing as we move forward. And I can tell you, we understand how important the testing is, and we are committed to doing everything possible.
Thank you very much. Great job. Thank you. Thomas Moriarty, CVS. We all know CVS. Thank you. Thank you, Thomas.
Thank you, Mr. President. We have been focused since the start of making sure our patients and the customers we serve have the information they need, the safety they need as well. We are committed to working with the administration and local public health officials to make this work as well. And thank you, sir, for the honor.
Thank you very much. Thomas Moriarty, CVS. We all know CVS. Thank you. Thank you, Thomas.
Thank you, Mr. President. We have been focused since the start of making sure our patients and the customers we serve have the information they need, the safety they need as well. We are committed to working with the administration and local public health officials to make this work as well. And thank you, sir, for the honor.
Thank you very much. Thanks. Great job. And Bruce Greenstein, LHC Group, tremendously talented people. Thank you very much.
Mr. President, thank you for the honor of being here. And the home health industry has been treating patients and seniors in the safety and comfort of their own home for decades. We're very proud to be part of the equation for testing in their own home. For Americans that can't get to a test site or live in rural areas far away from a retail establishment, we're here to help and to partner with our hospitals and physicians, as well as the people we have here today that will be doing testing around the country. Thank you.
Thank you very much. Oh, we'll practice that. Okay, I like that. That's good. We're also announcing the following emergency executive actions today. To help our students and their families, I've waived interest on all student loans held by federal government agencies, and that will be until further notice. That's a big thing for a lot of students that are left in the middle right now. Many of those schools have been closed. Based on the price of oil, I've also instructed the Secretary of Energy to purchase, at a very good price, large quantities of crude oil for storage in the U.S. Strategic Reserve. We're going to fill it right up to the top, saving the American taxpayer billions and billions of dollars, helping our oil industry and making us even further toward that wonderful goal which we've achieved, which nobody thought was possible, of energy independence. It puts us in a position that's very strong, and we're buying it at the right price. And that's something that would have not even been possible a week ago. The price of oil went down quite a bit, so we're going to fill it up. It's a good time to fill it up. I'd like to ask Mike Pence to say a few words, please. VP.
Thank you, Mr. President. It is, this day should be an inspiration to every American, because thanks to your leadership from early on, not only are we bringing a whole of government approach to confronting the coronavirus, we're bringing an all of America approach. Mr. President, from early on, you took decisive action. You suspended all travel from China. You created travel advisories, South Korea and Italy. We screened all travelers from all airports in both of those countries. And on the unanimous recommendation of your health experts, you, at midnight tonight, will effectively suspend all travel from Europe. And Americans that were returning will be screened and asked to voluntarily participate in a 14-day quarantine. Throughout this process, Mr. President, you put the health of America first, but you brought the best of America to address it. And it's not just at the federal level. As you said, Mr. President, we've been working with states across the country. We issued broad guidelines from CDC for every American. But this week, at your direction, we tailored specific recommendations from CDC for New York, Washington State, California, Massachusetts, and Florida. And we've been in continuous contact, as you said, with governors around the country. And Mr. President, you have forged a seamless partnership with every state and every territory in this country to put the health of our nation first. But today, I trust that people around the country that are looking on at this extraordinary public and private partnership to address the issue of testing with particular inspiration. After you tapped me to lead the White House Corona Task Force, Mr. President, you said, this is all hands on deck. And you directed us to immediately reach out to the American business sector, commercial labs, to meet what we knew then would be the need for testing across the spectrum. And today, with this historic public-private partnership, we have laid the foundation to meet that need. For Americans looking on, by this Sunday evening, we'll be able to give specific guidance on when the website will be available. You can go to the website, as the President said. You'll type in your symptoms and be given direction whether or not a test is indicated. And then at the same website, you'll be directed to one of these incredible companies that are going to give a little bit of their parking lot so that people can come by and do a drive-by test. Mr. President, I want to join you in thanking Walmart and CVS and Target and Walgreens. These are companies that are synonymous with communities large and small, where people come together, and now they're going to come together to meet the needs of the American public. These commercial laboratories, LabCorp and Quest and Roche, have just done an incredible job stepping forward, and they're going to literally make hundreds of thousands of tests available and being processed with results to patients in the very near future. But it's all a result of you tasking us with bringing together not just government resources, which all state labs can now test across the country. CDC is testing. But you said, Mr. President, that we wanted to bring all the resources of the country together, and that's what this partnership really means. You know, the truth is that we have coronavirus cases now in 46 American states. And while the risk of serious illness of the coronavirus remains low, we want to encourage every American to practice common sense, practice good hygiene, Go to the CDC's website to see what the guidance is for your community or for the American people broadly. And as the president has said, it's especially important now that we look after senior citizens with chronic underlying health conditions. Last week, the president directed the Center for Medicaid and Medicare Services to raise the standards at our nursing homes, increase inspections at our nursing homes. And today we're offering very specific guidance, which Seema Verma will articulate about visitations at nursing homes. It's important to remember that they were there for us when we were growing up, Mr. President. They helped us with our homework. They tucked us in at night. They cheered us on as we pursued education, cheered us on in our careers. And now it's time for us to be there for them and to recognize that seniors with chronic health conditions are the most vulnerable, and Americans can make a difference. So wash your hands, use common sense, look after the most vulnerable. And Mr. President, I know I join you in saying that every American should be proud of this incredible public-private partnership that's going to be speeding access of testing to millions of Americans in the weeks ahead. And together, as you've said many times, together we'll get through this. Together we'll put the health of America first.